responding to me, nothing, all right? Walk up to him, sir, you okay? Hey, you all right? Nothing? All right, sir, okay, nothing? Okay, now he grunts to my sonoro. Now I know he's responding to painful stimuli only. Airway, breathing, circulation. For me, this is how I do it. You're gonna follow his, okay? You're gonna follow your sheet. For me, I look at his mouth, okay? Airways open, you come over here, I'm not saying to do it. We get my partner, get a modified jaw thrust. You modify jaw thrust, open his airway up, alright? Come here, he's breathing, okay, I put my hand on his chest. He's breathing like, whatever, 8 times a minute. Okay, cool. Alright, come down here, check for a pulse, nothing, check for a pulse, got it there, or it's down here. He's got a pulse, I feel that it's strong, weak, whatever. I take a mental note of that. For you guys, you can verbalize it. Pulse is strong, you got a good rate. ABCs, for me, ABCs are done. Alright. Your sheet says to do things, follow what this school teaches you, follow what the sheet says. Okay, so come back up here. I feel his breathing is adequate for his rate. That's good. I inspect over now I'm exposing, examining, I'm cutting his shirt off, taking his pants off, whatever. I'm exposing everything, okay? Now, it says here to listen. So come back up here, expose everything. I'm visually looking at his chest. This is all happening fast. Visually looking at his chest, I don't see anything clearly obvious. I also take one side, the other. He's got breath sounds, cool. Set that down to the side. Now I'm, any kind of seal flow side, I don't see anything here on the chest. I'm moving on. Check, no blood. No blood. No blood. A little bit of blood. No blood. Okay. Skin color. He looks pale. He's diaphoretic. He's probably in shock, right? So now, and then again, check his pulse this time. Yeah, I'm sorry I said that. So check his pulse, whatever. That part's done. ABC's done. Now I'm moving on to my DCAP test of my rapid trauma assessment. This is where I was really taught. This is how I do it. I go like this over the dome. I palpate in here. I'm looking in the nose, looking in the mouth, same time. Come around here. I finish the back of the neck. I'm checking this. I tell him C-spine. Give me a C collar on him. Come in here, check. Run down. Check. Nothing there. 1, 2, 3, 4. Middle. Nothing. Okay. I don't feel any rocking. I push in. I shake a little bit. Come down. It's obviously deformed. Maybe feel for a pulse. Take a quick second. If I don't feel one, for 1 second, moving on. Sitting around. Feel here. Okay, he's got a pulse here. That arm's good. That arm's good. Pulses in both. Okay, come here. That's done. Now I'm rotating him. We rotate him. I check his back. Get in the backboard. Let's go. Back to the truck. That's when I come back up to the top. Yes, you were right on that. You do repeat yourself. But what are you doing? You're setting a trend. Oh man, on scene, he didn't have any kind of, like I said, distension. Now he does. So you can start like the head again. This one, you're en route. You give me a set of vitals. You give me the rate rhythm quality on his respirations and his pulse. As I come back over here, now I'm checking pupils. I'm really looking in the nose. I'm looking in the mouth. Now I'm checking the ear. Okay? Again, reassessing the trachea. All right? Now I'm listening. And if I can, from the side, if I can, up under the back there too, listening to his abdominal sounds. Now I'm really palpating in there. I'm taking my time because we have some time, we're in round. Really palpating. Feeling around. Okay, that's good. This again, if his pelvis is broken, you're gonna notice it the first time. You're not gonna break his pelvis by moving. So I come in here again, I kind of quickly, all right, that's good. This now has been addressed. I can bandage it if anything's showing. I can do whatever I need to do with this. Again, check for a pulse, really feel for a pulse now. I mean, he has some pulses on that foot. Mark it down. All right? You're not gonna fix that, a trauma surgeon will. All right? That's your detail, okay?
During your detail, after the initial, during your detail, that's when you'll have them put on the collar?
No, the collar, I'm sorry, the collar is, okay, so I get on scene, check the ABCs, collar, that's what I said, I'm pretty sure it was around that time.
Okay.
I tell them to put a collar on, after I initially check my ABCs.
Okay, good.
Alright, because what you do with ABCs, your airway, maintain it, and how do you maintain that? I mean, you can see some precautions is, right there after general depression.
Okay.
So in that block, again, follow your sheet.
Yeah.
Your sheet is going to tell you when you should put it on. All right, I've been doing this differently. I was taught differently, but I have to teach you like this. So follow your sheet.
Okay.
Okay. So you get on scene, general depression, cease my precautions. Here's a high card. get it on there, get it on after your general impression, alright? But for me,
This.
according to your sheet, it says, general impression, manual C-spine precautions. So get that on there, get the manual C-spine, and then your ABCs, okay? And during your, like I said, during your ABCs, that's when you might put that on. You're gonna have C-spine precaution, which
So-
would hold,
C-spine precaution.
is just